This film is intended for eye surgeons for training and education purposes. The viewer's discretion is advised. Hello friends, I am Dr. Abhinav Prakash. This video is regarding a brief tutorial about Hex Ring. I am sharing some practical tips about using it. I started using this device quite recently after a few of my friends requested me to make a video on this device. I believe that a standardized technique and protocol is going to hasten the learning curve whenever you start using a new device or technique. So that's the whole idea behind making this video. So before beginning, let's understand a little bit about Hex Ring. So this device was created by Dr. Suven Bhattacharya, and this is a great tool to manage small irises and floppy irises issue. Let's understand a few things about this device. It has 6 notches and 6 flanges. 3 of these flanges have these holes and 3 of them don't. Ones with the holes and ones without are alternatively placed. The idea here is one of the alternate flanges go behind the iris and simultaneous the notch on either side engage the iris, and the adjacent notch will be above the iris. So let's begin with the case. This is a case on tamsulosin for prostate problems. He has pseudo exfoliation and moderately dilating pupil. So let's begin the surgery. I first make the side ports with the help of globe stabilizer and introduce the anesthetic inside the eye. I introduce the OVD under the iris first to separate the adhesions. You can see the pseudo exfoliation material on the anterior capsule. In such cases, I first prefer to do the stretch pupilloplasty with the help of 2 Sinskey hook or dialer. So we can see the pupil is very rigid and there is not much dilatation even after stretch pupilloplasty. So I begin with the main port incision temporally. This whole case is going on under topical anesthesia. So this is the Hex device, looks like. So I introduce the device inside the anterior chamber using the McPherson or straight forceps. After introducing it through the side ports, I grasp the opposite side flange with the holes with the forceps or dialer and maneuver it behind the iris, simultaneously ensuring engaging the 2 adjacent notches on the pupillary border. We now notice the adjacent flange is now on the iris next to the same position. Engage the next flange with the holes behind the iris and again push it behind the iris and the adjacent 2 notches on the pupillary border. Repeat the same procedure. So the last flange with the holes go behind the iris and the adjacent 2 notches on pupillary border. So we have 3 flanges above the iris and 3 alternate flanges with the holes beneath the iris, and 6 notches engaging the pupillary border. This gives us a hexagonal pupil. So there is sufficient pupillary expansion. Now we begin with the routine phacoemulsification. So the rhexis is started with the help of acetone. Try to keep the adequate size rhexis, 5.5 to 5 millimeter. Care should be taken not to put much stress on the zonules, as this is the case of pseudo exfoliations, and the zonules will be weak. Careful hydro dissection. So let's finish with the capsular rhexis first. Now the careful hydro dissection and delineation is done. Be careful, as the iris is floppy. It is anticipated to be floppy, so it may come, peripheral iris may come through the side ports or main ports. So, and let's rotate the nucleus. It is mandatory to rotate the nucleus inside the bag before starting the phacoemulsification. Now just coat the endothelium with OVD before starting the phacoemulsification. So the phacoemulsification is performed. For such cases, it's better to master yourself in the vertical chop technique, because there is not much room for horizontal chop. Irrigation and aspiration is done. The cortex is aspirated carefully, because in such cases we can't afford to have any complication, any other complication. The IOL is implanted inside the bag. This is single piece PMA lens, foldable IOL. The viscoelastic is removed thoroughly from behind the iris and from the bag. Now it's turn to remove the device in the similar fashion. Turn by turn, it is disengaged from the pupillary borders. All the flanges are disengaged, and it is very easy to remove the device. So the device is removed. Device is removed through the side port, through the main port. The removal is extremely quick and easy, and that is the best part of this device. The remaining viscoelastic OVD is removed with the coaxial irrigation aspiration. So, hydrating the main port and side port. So this case was planned with intravitreal anti-VEGF injection also, as for the diabetic retinopathy. So let's quickly review the 5 steps for inserting the Hex ring. First, to inject the OVD behind the iris. Second, device is completely introduced into the anterior chamber and placed upon the iris. Third, from the side port, simultaneously grasp the opposite side with the flanges with the holes with the dialer and maneuver it behind the iris. Fourth, repeat the same procedure with the adjacent flange. And fifth, after switching the hands or with the same port, maneuver the opposite and the last flange, similar fashion. So conclusion. To conclude, I have found that the following, the standardized technique in the form of these 5 steps with the combination of stretch pupilloplasty when required, has helped to utilize the benefits of this device a lot. Thanks for watching, and I hope you must have liked the video and our efforts. Thanks a lot.